My name is J. Randall Wilkerson. I'm the author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 4 of a 58-part video series of the entire book. If you have not already listened to the introduction, you can check that on our channels. Part 4 covers causes of heart failure in Chapter 2. It's rather important to stop the cause before you can treat heart failure. This is, of course, natural common sense, and you may already know the cause of your condition. However, there are many different areas that people overlook, including doctors, because so many causes have proliferated in these modern day. The first and major cause is heart disease. Coronary artery disease will, of course, damage the heart, which causes heart failure in the sense that the heart is dying and getting weaker and weaker. That needs to be corrected, of course, before treatment can be totally successful. However, the treatment plan often is effective at treating heart disease. So go ahead and apply everything in the book before you have successfully handled every part of heart disease with your doctor. Part B is high blood pressure. This is the second most frequent cause of heart failure or hypertension. In the study Heart Magazine in 1996, 52.8% of hypertension subjects died of heart failure. In the Framingham study of a large general population group in Massachusetts, 75% of those who died of heart failure had high blood pressure or hypertension. So eliminating high blood pressure is, of course, quite important. In this book, there are a number of enzymes that do naturally lower your blood pressure to normal. Part C is myocarditis. This is a condition where your heart becomes inflamed. Estimates are 5 to 20% of all cases of heart failure are caused by this inflammation. There is an enzyme in the book, bromelain, that does fight off inflammation, and it is reported in Chapter 5. Part D, faulty heart valves. Many persons are born with a heart valve defect, and leakage as well as greater effort needed by the heart to pump enough blood to support you. Surgical treatment is the standard option, but your doctor will, of course, help you with that. Part E is heart muscle damage. This can be by a bacterial infection or excessive alcohol consumption. It can be due to genetic causes, or dilated cardiomyopathy, of course, is where the heart enlarges, growing weaker and weaker. Part F, medication-induced heart failure. There are many medications approved by the FDA that cause heart failure as a side effect. Typically, a small percentage of persons are affected, in other cases, larger percentages. Somehow I never considered heart failure to be a side effect, but watch for those drug commercials which say that new or worsening conditions of heart failure are a side effect. Among those drugs, number 1 are antiarrhythmic drugs. These are medications that are known to cause congestive heart failure in some patients. There's a list here that you'll need to review from the book. Now, Part 2, beta blockers. Beta blockers are a most common medication for treating heart disease, yet some of them cause heart failure. Some do not, at least at this point, have not been found to cause them, such as carvedilol. Number 3, non-steroidal anti-inflammatory drugs, or NSAIDs. These are painkillers. Yes, all painkillers, from aspirin, Advil, Aleve, Tylenol, you name it, all of them. 20% of congestive heart failure admissions in one study, one clinical study on the footnotes here, were due to overuse of pain-killing medications, over-the-counter medications. Among those subjects with a family history, the increase in risk of heart failure is 10 times, 1,000% increase if you have family members mothers, fathers, grandparents who had heart failure, then taking pain medications increases your risk by 10 times. Number 4, calcium channel blockers. Number 5, fen-phen. This was a diet drug marketed in the 90s, and yet some people are still contracting heart failure that took it years ago. Number 6, immunomodulators. Interferon medications can increase cardiac arrhythmias and heart failure. Number 7, antidepressant and antipsychotic drugs. Some are known to affect the electrical heart control signals, causing sudden death, immediate heart failure. In fact, one friend of mine contracted such from a antidepressant medication in 4 days, and that was just a few months ago. Number 8, chemotherapy drugs. Certain types cause heart failure. 18% of those treated with one medication for breast cancer developed heart failure within 1 year. There are other miscellaneous drugs under Part 9, and of course under Part 10, recreational drugs, amphetamines, morphine, heroin. These all can cause heart attack, strokes, heart failure, sudden death. Breathing volatile paint fumes, LSD, psychedelic mushrooms, marijuana. These are all drugs. Maybe they sound normally recreational, yet they are deadly serious drugs when it comes to causing heart failure. Diabetic drugs, glucose-lowering drugs used for diabetic treatment have been harmful to heart failure patients in one clinical study. In Part G, you may have been born with a heart defect. This is for your doctor to discover. I was born with a genetic defect that got worse as I aged until finally it tripped into constant atrial fibrillation, or AFib. And that led me to class 4 heart failure in 10 weeks' time. Very quick, from a healthy bicyclist to near death. Part H, chronic diseases. Certain diseases can cause heart failure. Hypothyroidism, hyperthyroidism, some caused by lack of iodine in your diet. Part I, sleep apnea. In one clinical study, 51% of the male patients had heart failure. That's half of all the sleep apnea patients. If you have sleep apnea, go to your cardiologist or find the best one and have an analysis done. Abnormal heart rhythm, or Part J, occurs in a large percentage of the population. These can be called heart palpitations, preventricular contractions, or PVCs, cardiac tachycardias, heart arrhythmias. All of these can interfere with blood flow, and they are preceded before every event of sudden death. They actually are the trigger. Part K, alcohol consumption. You may have heard that it's good to drink red wine, at least 1 glass every day, because some study indicated that it is helpful for heart disease. It is not helpful for heart failure because alcohol is a toxic poison to the heart muscle. Your heart muscle is constantly regenerating, so it doesn't do any good to increase the death rate of muscle tissues with alcohol. If you hear of somebody in their 20s or 30s diagnosed with heart failure, it is often referred to as alcoholic heart failure. It is caused by overconsumption. Finally, broken heart syndrome. If you remember reading in the newspaper that a wife died a few days after her husband died, most likely it's due to broken heart syndrome, in which a woman past menopause will suddenly, under the extreme stress of the loss of a mate, cause adrenaline to rush to the heart, causing muscle damage and paralysis. So in summary, this chapter is a quick synopsis of the causes. You need to checklist to make certain they have all been accounted for and that none of them are involved in your case. So this concludes Part 4 of the video series on the heart failure recovery plan, successful heart regeneration using metabolic enzymes. My name is J. Randall Wilkerson. I'm the author. You can obtain this book from Amazon in print and Kindle editions, from the Apple iTunes Store in the iBooks edition, from eBay in a print edition, and directly from the publisher, Wilkerson and Hughes, P.O. Box 777, Altoona, Florida 32702. Just include a check for $24 to cover the cost of the book and shipping. Thank you for listening.